Chapter 9, Image Distribution. Image distribution within a radiology department has to be very well thought out. The majority of users within an enterprise use relatively low-cost PCs that have normal network connectivity. However, these users, most of them being radiology techs, often have workflow requirements that are more demanding than even the radiologist's workflow requirements. This chapter will help you better understand how to implement an effective enterprise image distribution strategy. So the first thing to keep in mind, and one of the overall most important factors, is that flexibility is key. There is no one-size-fits-all option for every user out there. A PAC system must fit the needs for all of its users and not just a select few. An imaging informatics professional must get input from all types of users and assess each of their needs when designing and implementing an image distribution strategy that will fit enterprise-wide. There are different users, as I've said. We're just going to talk about each user briefly and what their needs are. So first, there are non-critical users. Just like the name says, they don't require access often, so they're non-critical. They depend on radiologist reports more than the images. They do not require full fidelity images, meaning that they do not have to be diagnostic quality. In comparison, the radiologist's images have to be diagnostic quality in order to read them. The non-critical users are more concerned about being able to view the images quickly and easily with the use of a simple web image viewer. The non-critical users access the images through the electronic health record more frequently than they would going to a PACS workstation. You can use just regular off-the-shelf monitors. There are no display requirements for non-critical users. A family practice doctor is an example of a non-critical user. Next are the exact opposite, the image-intensive users. They often make patient management decisions based on image interpretation. They do require full fidelity images, so they have to be diagnostic quality. They demand real-time image delivery, so pretty quick. This includes the prior relevant images as well. They require the use of diagnostic quality monitors, and orthopedic doctors, ER doctors, those are examples of image-intensive users, which makes sense if you work in a setting similar to those, since they are pretty needy with their images and they want them pretty quick. So next we'll talk about functional requirements of the image distribution process, starting with performance. Radiologist workflow can often include auto-routing and prefetching. Auto-routing is pretty simplistic to its name. It is the automatic routing of image data sets from the modalities to the remote destinations based on predefined rules. An example of auto-routing is when all abdomen CT exams should be auto-routed to strictly the abdomen reading room workstation for that radiologist to read. Prefetching is the automatic delivery of image data sets from the image archive to designated workstations based on predefined rules. Prefetching is used in mammography. Sometimes the machine is set to prefetch all of the next day's relevant priors, so the radiologist has them and is ready when the actual exams are taken that day. That way he can compare them to each other. Moving on, cost effectiveness, that's another requirement of image distribution. Then integration into the EHR. It should not be difficult. Everything should be seamless. So moving on, security. HIPAA rules still apply with image distribution. Navigation should be relatively easy to use. You don't want an image distribution system that is cumbersome and not easy to use. And then there's scalability. must be able to provide high performance image distribution throughout the entire enterprise, so it has to work on every level. And there are usually simultaneous users. Technical strategies for image distribution. We'll start with the thin client that relies on computing power from the centralized servers to view the images. Images are not stored on the actual thin client. It uses plugins like Java or Flash, and it uses common web-based image delivery techniques. So again, that lossy image compression comes up. Lossy image compression reduces the size of image data. And also the web-based image delivery technique has a just-in-time approach or real-time streaming approach, and it delivers image data sets just when or before it is needed. It doesn't require lossy compression, and it provides high image delivery performance. So there are certain locations within the hospital, certain departments that have specific workflow considerations per their location. So we'll talk about the emergency room and the operating room. For the emergency room, they are an image-intensive user. So they require the diagnostic quality images and near real-time delivery. And they require dedicated client computer with diagnostic quality monitors. So then there's the operating room. They use pre-procedural planning, which are images viewed prior to operation. And this is just an example for the type of image distribution that is used during surgery. The doc will always look at the images prior to the surgery. Interoperative image correlation is when images need to be viewed while performing the operation. An example is in neurosurgery. They need diagnostic quality monitors in the OR, and the multiple monitor configurations are usually required, so they'll be set up, maybe even a dual monitor situation, or set up on different ends of the operating room so that the doctor can easily view them at any angle. And they also require near real-time image display. So then you have your specialty clinics, so like ortho and neuro. They do require diagnostic quality images as well, near real-time image delivery, including their priors, and they require access to images in every clinic room. They require the ability to efficiently display CT and MR data sets. And then you have teleradiology. They require diagnostic quality images, so they're making the actual primary interpretation of your CT or MRI, for example. So of course they need the high quality images. They need near real-time image delivery, including priors. They require diagnostic quality monitors with routine calibration to make sure that they are staying high quality. And they require the ability to use the dictation system remotely. Okay, so there's been a significant increase in the isotropic volumetric image data, which means that these large files also increase storage issues. So what is the solution? The Advanced Visualization Server Thin Client. It uses a 3D image processing engine server with immediate access to complete isotropic image data sets from PACS, from the PACS archive, or from the modality. The server does most of the work, meaning it does the rendering and the computation, and sends the results of the work to the thin client. It allows for high performance on thin web clients and allows for much lower network and client resource requirements.